Ultra lubricant eye drops are used to relieve dry, irritated eyes. This can be caused by various factors such as wind, sun, heating/air conditioning, computer use/reading, and certain medications. The ingredients in this product may include carboxymethylcellulose, dextran, glycerin, hypromellose, polyethylene glycol 400, PEG 400, polysorbate, polyvinyl alcohol, povidone, or propylene glycol, among others. These eye drops help to keep the eye moist, protect it from injury and infection, and reduce symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. When using ultra lubricant eye drops, make sure to follow all the directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. Be sure not to use the solution if it has changed color or is cloudy. Some brands may have a milky appearance, but as long as the solution does not change color, it is safe to use. Some eye drops need to be shaken before use, so be sure to check the label before using the product. You can use the drops as often as needed, while ointments are usually used 1 to 2 times daily as needed. If using an ointment once a day, it is best to use it at bedtime. To apply the eye ointment or drops, wash your hands first and be careful not to touch the dropper or top of the ointment tube to avoid contamination. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops or gels, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. For ointments, hold the tube directly over the eye and gently squeeze a small strip into the pouch. Be sure to replace the cap tightly after each use. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications. It's also important to remove contact lenses before using most kinds of eye lubricants, unless stated otherwise on the package. If your condition lasts or gets worse after 3 days, be sure to consult your doctor. When you first start using ultra lubricant eye drops, you may experience temporary blurriness in your vision. You may also feel a slight burning or irritation in your eyes. If these effects persist or worsen, it's important to consult your doctor. If your doctor has prescribed this medication for you, it's because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as eye pain, changes in vision, or continued redness and irritation in your eyes. While severe allergic reactions to this medication are rare, if you notice symptoms like rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. Remember, this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. It's important to follow the dosage instructions provided by your doctor. If you have any concerns or questions about the use of ultra lubricant eye drops, don't hesitate to reach out to your healthcare provider. Before using ultra lubricant eye drops, it's important to talk to your doctor or pharmacist if you have any allergies. The product may contain inactive ingredients that could cause allergic reactions or other problems. If you have any health issues, make sure to consult with your doctor or pharmacist before using this product. After applying the eye drops, your vision may become temporarily blurred. It's important to avoid driving, using machinery, or doing any activities that require clear vision until your vision has cleared up. When using ultra lubricant eye drops, it's important to be aware of any potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval to ensure safe and effective use. If this medicine is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to keep this medicine out of reach of children to prevent accidental ingestion. When using ultra lubricant eye drops, be cautious if you wear contact lenses or have allergies. Some products with preservatives may harm your contact lenses or cause irritation if you have allergies. It's best to check the product package or consult with your healthcare professional for more information. This eye drop medication is typically used on an as-needed basis. It is designed to provide lubrication and relief for dry, irritated eyes. Many people find it helpful to use these eye drops in the morning and evening, or whenever they feel discomfort in their eyes. Make sure to check the storage information on the package and keep the eye drops from freezing. If you're using preservative-free drops that come in single-use vials, you should discard them immediately after use or within 12 hours of opening. Be sure to check the package to see when you should discard your specific product. And if you have any questions about storage, ask your pharmacist. Remember to keep all medications away from children and pets. When it comes to discarding the eye drops, make sure not to flush them down the toilet or pour them into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. And if you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.